Welcome to second season of Physiocast. Today we have a very special guest in our show. He is an international guest. He is a very renowned minimal access orthopedic surgeon from Delhi. His name is Dr. Ashwani Maichand. I would like to welcome him in our show. Welcome to our show.
Thank you, sir. Thank you very much. And first of all, I would like to congratulate you that you all did such a good job by giving this information on this platform, Physiocast. And I wish you all the best that you keep on doing this good job in years to come.
Thank you very much, sir. Now let's begin with let's directly jump to the topic. What is minimal access surgeries? What is minimal invasive surgeries? What is that?
Actually, if you see a surgeon's career, there are three phases actually. Once when he's a resident, he's learning. People look at him, how good a team member he is. Then the person comes out of the college, starts practicing.
Okay.
Then we see how good a surgeon he is.
Welcome to our show.
Thank you, sir. Then there's a third stage when the practice is established. I would like to congratulate. Then the surgeon starts thinking not about himself as a surgeon, but actually he starts thinking about patients. He starts thinking from the patient's angle. So after a few years, now it's 25 years in the field.
Yeah.
And last few years, or I would say last decade, I started thinking about patient's angle, that why people in our Asian, you can say the Indian subcontinent, why they are so reluctant in going for surgery.
Yeah, and that's what.
Yeah, means they have severe problem, they are suffering, they are taking painkillers, there's so many complications. You advise them surgery and suddenly, no.
I have seen many things whenever we say we have to go for surgery, patient get scared oh no, after surgery something will happen, these things will happen that. What we have to add on that conservative surgeries old traditional surgeries, and what is the difference between minimal invasive surgery? As I asked you, what is the what actually it is minimal invasive surgery?
We actually try to address the issues. We try to address the issue. The issues are patient is scared because of 2-3 reasons, main reasons. One is finances.
True.
People in our area, many of them don't have any medical insurance. They have to pay from their pocket.
True.
That is one. Second, even if the patient can afford, they are scared of complications. During surgery complications, they are scared that I might go to ICU. I may not come out of the hospital walking. Or sometimes they feel that after the surgery, there will be too much pain. There's long physiotherapy, long bed rest. And as we see, we have nuclear families now.
Yeah, true.
People can't afford to take long leaves from the office.
True.
So these are some issues that people are scared. So with minimal access, we have tried to address all these issues.
True.
And when in the last, this thing I'll come to, that there are certain things that when we do a surgery, we ask the patient that throughout your life, you are not supposed to do certain things, which are very much part of our culture. We'll come to that in the later part of the scene. And last, for example, in orthopedics, we do a joint replacement. People start thinking about revisions, that if I have to go for a second surgery, it's going to be worse than the primary. So once we started thinking about this, then came the minimal access, or I would say MIS technique. That is minimal invasive surgery.
And as you said, they have some issues, like people are scared of these things, financial matters also, the working things. As you said, nuclear family. Despite of that, or if we relate on this topic, how do MIS techniques help in these things?
In conventional technique, what we do is we give big incisions. We have to open up the muscles, the tissues, the capsule. For example, about hip replacement or a knee replacement or a spine surgery. What happens? During surgery, there's lots of bleeding. There's stress on the body. And especially patients. वो पेशेंट जिनको कोई किडनी की प्रॉब्लम है, कोई लीवर की प्रॉब्लम है, कोई हार्ट प्रॉब्लम है, if you expose them to a big surgery, there's lots of bleeding. Sometimes these patients go to ICU and their hospital stay becomes longer. Longer the hospital stay, more the hospital bill.
And complications as well.
And complications and post-operative pain. And they have to take longer bed rest, longer rehab, and they have to be absent from the duty for a long period. So this is how we came up with MIS technique.
यस्तो व्यस्त टाइम टेबलमा आफूलाई फिट र स्वस्थ राख्नु त च्यालेन्ज नै हो। त्यसैले म हरदम स्वस्थ रहन डाबर च्यवनप्राश खान्छु। वास्तवमा म सानो हुँदादेखि नै मेरो मुवाले मलाई डाबर च्यवनप्राश खुवाउनुहुन्थ्यो।
47 आयुर्वेदिक तत्त्वयुक्त डाबर च्यवनप्राशले बढाउँछ तपाईँको इम्युनिटी पावर। डाबर च्यवनप्राश घरमै 2 चम्चाको तयारी, राख्छ टाढा बिमारी।
म त गर्छु दिनौ 2 चम्चाको तयारी डाबर च्यवनप्राशको। अरू होइन, डाबर च्यवनप्राशकै।
Actually, this is like it is a new technique. It's a old technique. When it started, like, is it practicing in only in India or any other countries? Like, what about these things? Like, is it more like worldwide spread, or what is the things on this? Is
Look, actually, we modified the conventional technique. We were already well versed with the conventional technique. इतने सालों से हम conventional technique ही use कर रहे हैं, लेकिन हमने धीरे धीरे उसको इतना मिनिमम कर दिया है कि हमें एक्चुअली जहाँ जाना है, जैसे जॉइंट के अंदर जाना है, तो हम वहीं पे फोकस करें जहाँ पे हमें सर्जरी करनी है, जिसको हम कहते हैं ना कोलैटरल डैमेज। वो हमने बिल्कुल बंद कर दिया है।
Okay.
जनरली हम लोगों को जो पहली बार बताते हैं वो सोचते हैं कि इट्स ए स्मॉलर इंसिजन, बट इट्स नॉट ए कॉस्मेटिक सर्जरी। वी आर नॉट बॉदर्ड अबाउट इंसिजन साइज, वी आर बेसिकली कंसर्न्ड अबाउट व्हाट इज बीइंग डैमेज्ड इनसाइड। फॉर एग्जांपल, हम हिप रिप्लेसमेंट करते हैं, हम किसी भी स्ट्रक्चर को, चाहे वो जॉइंट कैप्सूल, चाहे लिगामेंट्स हैं, चाहे मसल्स हैं, किसी भी चीज़ को हम डैमेज नहीं करते। तो योर हिप रिमेन्स एज एनाटमिकल एज इट वाज बिफोर सर्जरी।
We can say it's a pinpoint surgery.
Exactly. So it is, I would say, a bigger form of endoscopic surgeries.
Okay.
जैसे हम लेप्रोस्कोपी सर्जरी करते हैं, आर्थ्रोस्कोपीज करते हैं, it's not through endoscope, but it is means we have to reach there and there only, nothing else.
Is there any types of MIS techniques?
MIS techniques is generally of 2 types. One is that we are doing knee and hip replacement by MIS technique, and second is you must have seen patients, if you mention a spine surgery, they never come back.
Yeah.
They are so scared.
Yeah. True.
So we have started doing it by actually endoscope. We use just a 4 mm endoscope. We whether it's a disc prolapse or a stenosis or a instability, we do all these surgeries now by endoscopic technique. Except in tumors or revision surgeries, we do 90% of our spine surgeries now by endoscopic technique. So these are the 2 main variants of MIS, what we are offering to the patients.
What are the advantages of MIS techniques apart from what we have discussed?
Yes, the biggest advantage that we have come up with, that in our Indian subcontinent culture or even in Oriental countries, sitting on the ground is a very vital part of the culture.
True.
Whether it's religious activity or simple having food.
Yeah.
Means 90% of people don't use dining table. They sit on the ground or on bed or especially in social gatherings. We all prefer to sit on the ground. Marriage ceremony or other religious functions, we prefer to sit on the ground. If you do a hip replacement by a conventional technique all over the world, you are advised never to sit on ground.
True.
Number 2, we have Indian toilet available to every person in Indian subcontinent. There are, I think, 20 or 30% people who have access to Western toilets. So how can you expect a tribal, rural person to have a Western toilet in his every home? It's not possible. And for example, even if you get a Western toilet in your home, if you are going to a relative's place, first you have to call and ask them whether do you have a Western toilet? Can I come over? But that's a very embarrassing question to ask.
True.
So this MIS technique has allowed all our patients to sit on the ground, whether it's cross-legged or squat.
What makes the difference between MIS and the traditional surgeries? Like only the incision things, or is there any other particular things?
Incision is a very small part of it, because hip and knee are covered areas.
True.
Size of incision hardly matters. When we go inside, we have to first, the incision has to be placed exactly over the joint in a perfect orientation, so that when I put an implant, I don't have to struggle. If I struggle, I'll damage more tissues than a conventional technique. So my incision has to be perfect right on. And my retractors, the placement of my retractors, the angle of retractors, the position of the patient, everything has to be perfect.
True.
So that way, I don't cut them and I don't damage them. Means if I struggle, there will be so much of abrasion, the tissues will become necrotic, there will be so much of bleeding that patient ultimately will have collection and maybe infection.
Now let's talk about spine. Like nowadays, people are working, like their working nature is table work, takes up, like there'll be maximum time they'll be sitting, and because of like lack of exercise, because of micronutrient deficiencies, they are going through many problems in their back. Usually we go with like some exercise, some conservative treatment methods. If they have some problem with which they need to go with surgeries, what are the things they need to address, and why they shouldn't be worried about that thing?
Spine is basically lifestyle problem.
Yeah.
We are sitting people. We are all, means most of us are sedentary people. We are sitting on a chair or somewhere, driving, or means we are sitting on a seat somewhere. Means at least 8 to 9 hours a day.
True.
So we have 3 types of problem. One is young people who are working on laptop, on system every day. They have neck problem, that is cervical. That is generally treated conservatively by good physiotherapy, posture correction, all that. But second, people who are slightly into, I would say, hard work, lifting things, driving two-wheelers, they have this slip disc problem, जिसको हम कहते हैं sciatica, shooting pain होता है leg में, PIVD जिसको हम कहते हैं, generally it's L4-5 और L5S1. They need surgery. क्योंकि जब तक वो हमारे पास आते हैं, मैनी टाइम हम देखते हैं कि उनको या तो फुट ड्रॉप हो चुका होता है, मसल वीकनेस हो चुकी होती है, या उनको नमनेस हो जाती है, एंड इन सीवियर केसेस दे माइट हैव बाउल ब्लैडर इश्यूज. तो दीज पेशेंट नीड नॉट वरी एट ऑल, बिकॉज आजकल जब सारे प्रोसीजर हैं स्पाइन का, हम एंडोस्कोपिक कर रहे हैं. पेशेंट कम्स इन द मॉर्निंग फास्टिंग, वी ऑपरेट, एंड बाय इवनिंग दे गो बैक वॉकिंग. तो आपको ना कोई बेड रेस्ट की जरूरत है. स्पाइन में जो सबसे बड़ा डर पेशेंट को होता है कि टॉयलेट जाना कब शुरू करेंगे, क्योंकि अभी तक जो इम्प्रेशन है स्पाइन सर्जरी का, लोगों को लगता है कि कई हफ्ते कई महीने तक they have to be dependent on others.
Yeah. Meanwhile, they are so scared about like they'll get paralyzed, they'll have some bowel and bladder dysfunction. Like they are so worried on that.
That is practically impossible now, because when I put a scope inside, I see the whole thing on a screen 20 times magnified.
True.
So it is difficult to damage something which is 20 times bigger than its normal size.
True.
So working with the naked eye and with the scope is entirely different thing.
And say, like we can say, like minimal invasive surgery, like endoscopic surgery of spine, is far safer than any other old traditional
Definitely
surgery.
No doubt. Now even we are doing fusion of the spine, fixation of the spine. We are putting new discs inside with a scope. There is no need to open up.
Okay. Now, if we went through any surgery of like endoscopic surgery, like in traditional things like in discectomy or any other things, like they have to go the series of physiotherapy protocols to get back to their life. Like what you have to say on this particular surgical technique and physiotherapy approach? Like they can go hand on hand, or like after this MI surgery there is no need of physiotherapy?
No, physiotherapy is a must, because patient जब हमारे पास आता है, they are already suffering for few months, not weeks. Spine surgery के लिए patient weeks में नहीं आते हैं. They come after months or years. इसका मतलब है कि वो कुछ सालों से या कुछ महीनों से अपनी मसल्स को यूज़ ही नहीं कर रहे हैं. The muscles are already wasted. और जैसे ही उनका पेन जाता है, they feel like कि अब मैं सब कुछ काम कर सकता हूँ. They suddenly start doing everything. अब उनको टू व्हीलर भी चलाना है, दौड़ के सीढ़ियाँ भी चढ़नी है. यंग पेशेंट्स होते हैं. They are not very careful sometimes, but muscles are weak. So few weeks later, if you are not careful, they are not doing physiotherapy, they come back with back pain, because muscles are not supporting the spine.
True.
तो हमें पहले दिन से ही फिजियोथेरेपी करना है, मसल्स को वापस शेप में लाना है. इसलिए हम सब पेशेंट्स को क्या बताते हैं कि 6 weeks तक no hard work. You can start simple walking, you can do simple exercises, but no two-wheelers, no bending forward, no picking of heavy weights. तो 6 हफ्ते का हमें प्रिकॉशन लेना है और फिजियोथेरेपी बहुत अच्छे से करनी है.
Okay. That means like MIS and physiotherapy goes hand on hand.
Yes.
Okay. Now, like some of the people might ask, like during like spine things, like I am having this much of disc bulge or disc herniation is there. Sometimes prolapse is also there, but they might not get symptoms. Sometimes they get symptoms. Sometimes. Okay. Like in that conditions, like is there any specific criteria that I should go for surgery?
Yes. Patient come to us with MRIs.
Yeah.
And now because people like you and me are educating them every day how to read an MRI, how to... That's a good thing. It's a good thing. People should be aware about it. But when they come with MRI and they tell us that this is a bulge and this is this L3-4, they tell us everything. The simple basic thing is that we are not treating the MRI. We are treating the patient.
True.
If patient has symptoms, operate. No symptoms, forget about it.
That is the thing. Like people usually in a spine case, they are like so scared on that part. Like if we say like if we have done any surgeries on spine, like endoscopic surgery, MRI surgeries, is there any specific data or like anything supporting evidence like this much of cases like you have done, or in entirely like in research paper, like how efficient it is? Like is there any research, any evidence on that?
So many patients come to us who had undergone open spine surgery for a simple disc prolapse in past, and they come back after a few months or few years with backache. Because in open surgery, we have to do laminectomy.
Yeah, true.
We have to remove the muscles.
Yeah.
So a structure which was already weaker because of disc prolapse, we are further weakening it by removing the bone and muscles. So that causes the instability. So in principle, and otherwise also, in evidence also, endoscopy is a much better option. Let's not weaken a already weak structure.
True.
Why to damage it? It's already weak. So we have, now we don't have any patient who comes back with to us after endoscopic spine surgery with backache. Because one, we are not damaging anything. Two, we are very particular about physiotherapy. Different.
Okay. Now let's talk about your experiences on endoscopic like surgery of MIS. Like, is there any special case like, okay, this is very severe cases and I have operated this and I have got some good results on that? Do you have anything to share on that note?
Yes. There are so many of them, but there was one particular patient. He was from area near Delhi. It's Nazafgarh. You must have heard about it. Virendra Sehwag is from Nazafgarh.
Yeah.
So this man was he was 35 years, young man. वो मेरे पास कोई 4 महीने पहले आए थे before surgery. मैंने उनको बताया कि आपको सर्जरी की ज़रूरत है, endoscopy, and I told all those things that we are discussing right now. उनको सब बताया. And as usual, they were scared of surgery. वो चले गए, उन्होंने कुछ मसाज कराया, कुछ वो बहुत सारे आजकल आपने देखा है कि वो chiropractic.
Yeah,
I'm not against any of the branches. They are working very well. But there's no evidence that if the disc is prolapsed, it is extruded, any technique other than surgery can bring it back. So it was an extruded disc. So he went about everything. उन्होंने सब कुछ कराया, मालिश कराया, सब ये सब करते रहे. For 3 months, 4 months, उन्होंने सब कुछ किया. They spent lots of money. And I think, on a Saturday evening, the family came to me with 2 people holding the boy in their arms. वो चल भी नहीं पा रहे थे. He had difficulty in passing urine. And they said कि अभी सर्जरी कर दी सी. Sunday हमारा OT closed होता है. But still, we did his surgery in the same evening, against the wishes of my staff, because Saturday को सब घर जाना चाहते हैं. But still हमने Saturday evening में ही उनकी सर्जरी की. And Sunday morning, he was back home, walking.
Wow, great.
So that day I realized that yes, we are doing something good.
Tremendous.
And that family can never forget us.
Yeah, true.
तो एंडोस्कोपी में इतना क्विक रिजल्ट आता है, इतनी फास्ट रिकवरी है कि वो कभी मेरे पास एक ही बार मिलने आए हैं उसके बाद.
Like this is only practice in Delhi, or it is practice in all other areas of India or any other country part? Like
we have just started it and we are actually holding seminars जिसमें हमारे जो young surgeons हैं who are just passing out, we are training them. Of course it's a long process, क्योंकि इसमें जो learning curve है it's very steep. तो जो नए बच्चे अभी MS ऑर्थो करके आ रहे हैं, they are very keen on it. तो उन बच्चों के लिए हम सेमिनार करते हैं, कुछ ट्यूटोरियल्स करते हैं, so that they also learn it.
Teaching as well.
If we devise something,
True.
After me, people should be practicing it.
True.
Because एक सर्जन कितनी सर्विस दे सकता है? If there are 100 people practicing this, तो हमारी पूरी population को फायदा होने वाला है.
True. Very true. Now let's move to hip. Okay. Usually, like in my practice, like going through many cases, like I have encountered very few in terms of Nepal, right? Like I'm not saying about India. Like when I used to practice in India, I used to see lots of hip cases. In Nepal, I have seen very few cases like in hip. Like how do you explain about the hip pathologies and about like minimal invasive surgery on that things?
When we talk about joint replacement, the general impression is knee replacement.
Yeah.
And ratio-wise also,
Mm-hmm.
80% of joint replacement is knee replacement.
Knee, true. Weight bearing joint.
Every young surgeon is, when they pass through their MS, सब knee replacement करना चाहते हैं. Everyone wants to go for a knee replacement कि मुझे सीखना है, मुझे करना है, ये करना है. There are very few good hip replacement surgeons because the volume is low. But सबसे बड़ी बात, जो सबसे बड़ा फैक्टर है, knee replacement का patient is generally 60 plus.
True.
They are elderly patients. They are generally retired and they are not working. Their physical demands are very low. Hip का patient is most of the time, 90% of the times is a young patient. चाहे वो AVN हो, चाहे वो ankylosing spondylitis हो, rheumatoid arthritis हो, sickle cell anemia हो, steroid हो, और especially COVID के बाद जब लोगों ने इतना steroid bulk में लिया है, we have flood of AVN. All of them are 25 to 40 years age group. ये prime of their life है. People are getting married, people are going into careers. इनका सबका education disturb हो रहा है, उनकी family disturb हो रही है. So this is a much bigger challenge for us.
Sure.
And ये जो young patient होते हैं ना, इनको accurate result चाहिए. 80 year का आदमी है, अगर angle थोड़ा इधर है उधर है, doesn't matter. Because they are just go for a morning walk. 25 साल का बच्चा है, 24 साल का बच्चा आया है, उसको शादी करनी है, तो उसको चाल भी ऐसी चाहिए कि कोई बता ही ना सके सर्जरी हुई है. So it's a very demanding job, I'm telling you.
Yeah, true.
So MIS has been very helpful to these people. अभी मेरे पास एक बच्चा आया है, this is July, he is getting married in October. अक्टूबर में शादी हो रही है. अब शादी में फेरों पे नीचे बैठना है. उसने कहा कि मुझे ऐसा हिप दीजिए कि मैं 3 months में नीचे बैठ सकूं. Can you see the demand? It's just a one day ceremony. लेकिन उसको नीचे बैठना, it is vital for him because life में एक ही बार शादी होनी. So it is very vital. Right.
Okay. You are saying like after minimal invasive surgery of hip, like they can go for sitting, cross sittings, like we have very ethnic background, very different cultural things, like people need to go for namaz, people want to go for puja and any other things. Like in previous traditional approaches, like they can't go for cross sitting and down sittings, like low sittings. There are chances of having dislocation in the hip. How are you managing to prevent that dislocations in particular surgeries, minimal invasive surgery?
Nature is the biggest scientist.
True.
The greatest scientist. हम single cell से शुरू हुए थे.
True.
Now we are Homo sapiens.
Yeah.
Human beings, most evolved जो animal kingdom में हैं, अब हम. But it took millions and billions years of research by nature कि हमने एक-एक organ बनाया. लेकिन हिप रिप्लेसमेंट कब शुरू हुआ? हार्डली 60 years.
True.
तो 60 साल में हम बिलियंस ऑफ ईयर्स को कॉपी तो नहीं कर सकते.
Can't.
वी कैन नॉट कंपेयर विद इट.
Yeah.
तो लेट्स टेक इट फ्रॉम द अदर एंड. व्हाई नॉट टू प्रिजर्व द नेचर? तो इंस्टेड ऑफ डैमेजिंग द ओरिजिनल टिश्यू, देखो नॉर्मल हिप हम बैठते हैं, हम चौकड़ी लगाते हैं, जमीन पे बैठते हैं, इंडियन टॉयलेट में बैठते हैं, देयर इज नो चांस ऑफ डिसलोकेशन बिकॉज नेचर ने इतनी अच्छी मैकेनिज्म क्रिएट की है कि डिसलोकेट हो ही नहीं सकता. When we are doing a hip replacement, हम भी तो हिप बॉल एंड सॉकेट ही लगा रहे हैं ना, तो हमारा क्यों डिसलोकेट हो रहा है? Why are we scared? क्योंकि हमने नेचर को डैमेज किया एंड पुट एन आर्टिफिशियल थिंग देयर. MIS टेक्निक में हम पूरी नेचर को ही प्रिजर्व कर रहे हैं. उसने जो हमें कैप्सूल दिया है, जो मसल्स दी हैं, जो लिगामेंट्स दिए हैं, हमने उसको ऐसे प्रिजर्व कर ली and we just put a ball and socket there so that it functions just as good as a normal anatomical hip. That is the basic principle.
Like while going through your YouTube videos, like I have seen one of the surgeries which you have done in that, you have got almost 50% of the femur and is still is going for the cross sitting and like low sitting. Is there any differences like थोड़ा कट करेंगे तो मतलब अच्छा रिजल्ट, बड़ा कट करेंगे तो बुरा रिजल्ट, ऐसा कुछ?
नहीं, ऐसा कुछ नहीं है. जब आप अंदर जाते हैं तो यू हैव टू डिफाइन ईच एंड एवरी फाइबर ऑफ द मसल. नॉट ए सिंगल फाइबर शुड बी डैमेज्ड. इट हैज टू बी वेरी मेटिकुलस.
ओके.
फीमर हम क्यों एक्सरसाइज करते हैं? वेदर देयर इज अ ट्यूमर और देयर इज अ ग्रॉस इन्फेक्शन, वो रेडिकली में रिमूव करना पड़ता है, अदरवाइज देयर इज नो चांस ऑफ सर्वाइवल ऑफ द इम्प्लांट.
Okay. Basically, what we need to understand is like there are many factors like young people's because of various factors, young people are getting problem in their hip. Apart from congenital issues, like they have like after like COVID, they have taken lots of steroids. They are getting a vascular necrosis and many other things. Like because of that, they have to go for the surgeries. Like major surgeries are from knees. Okay, and despite of that, so much of big improvements, like what we say, like the advancement of the technology in this surgery. How is it possible? Like जितना ज़्यादा सर्जरी होता है उसमें ज़्यादा नई चीज़ आता है ना, लोग तो हिप का तो कुछ कम ही होता है.
It's a demand and supply.
Okay.
My younger patients are more demanding.
Yeah, as you mentioned that, true.
They want to be as normal as before. क्योंकि आजकल जब से ये Facebook, Insta ये सब आया है तो everyone wants to look their best.
True.
तो it's more of a social presentation. They don't want to go around limping. अब आप कहीं भी जा रहे हैं, किसी गैदरिंग में जा रहे हैं, आप लिम्प करके चल रहे हैं, एवरीवन विल आस्क क्या हो गया, कैसे हुआ, कब से हुआ. तो ये सब चीज़ें वो अवॉइड करना चाहते हैं. एवरीवन वांट्स टू बी प्रेजेंटेबल. तो उनकी डिमांड इतनी ज़्यादा है दैट दे आर एक्सप्लोरिंग द बेस्ट ऑफ द थिंग्स. तो हमने एक तरह से, आई एम नॉट सेइंग दैट वी आर द बेस्ट, बट वी आर ट्राई टू क्रिएट अ बेटर थिंग फॉर देम. तो इसलिए अब इतने नंबर में पेशेंट्स, यंग पेशेंट्स हमारे पास आ रहे हैं, इसलिए इसमें रिफाइनमेंट हो रही है.
Okay, means like if they want something, we have to do something.
Yes.
True. Okay. Now, apart from that, let's discuss about some of the cases from your experiences only. What about like hip? Is there anything like this is the very challenging surgery for me? Why I'm asking this is like people should know like the doctor has done this kind of things so that he's so happy on that what he had done, right? Is there anything like you have to share for that?
फीमर में तो काफ़ी चैलेंजिंग केस हमारे पास आते ही हैं. एसिटाबुलर साइड इज़ मोर चैलेंजिंग एक्चुअली.
Okay.
वी हैड ए केस जिनका 10 years पहले एक सीमेंटेड रिप्लेसमेंट हुआ था. वी आर डूइंग ओनली नॉन सीमेंटेड.
Yeah.
यू मस्ट हैव सीन.
Yeah.
वी आर टोटली अगेंस्ट सीमेंटेड हिप रिप्लेसमेंट.
It's already outdated, I guess. It still is in practice.
Yes, cemented. 80% of people are still doing cemented replacements. We are now changing this scenario. MIS and non-cemented has totally changed the scenario. Now people, even a common man, even a simple patient will talk to you about cemented and non-cemented. Because we have spread that much awareness in people that they should ask for a good thing. So that's how evolution happens. So when a patient comes to us 10 years after a cemented replacement, what cement does? It eats up the bone all around. Cement से पूरी जो bone है वो खराब हो जाती है. Even in a young patient, bone ऐसी हो जाती है जैसे 80-year-old person की होती है. Soft osteoporotic bone and very thin wafer of bone is left. तो हमारे पास patient आए 10 years after a cemented replacement. उनका जो acetabulum था, it has gone into the pelvis. It was touching the bladder and arteries and nerves. So we had to extract it without damaging the arteries, without damaging the ureter, without damaging the bladder. It was a tough job. हमने एक सर्जन को भी साथ में रखा था in case we need to open up from the inside of the pelvis. तो we were ready for that also, but that was not required. तो हमने उसको पूरा extract किया. There was only rim of the bone left. Center में कोई bone नहीं था स्टेबुलम में. So जब उसको ream करते हैं when we widen it, तो reamer is a machine. अगर उसको sharp ream करोगे आप तो you can trap one of the structures from inside. तो we put a mesh there to defend those structures. We reamed it to the maximum level. और जो इंडिया में maximum size का acetabulum available, that is 70 mm. वो हमने उसमें डाला. And that person started walking, I think, 8 weeks later.
8 weeks, that is a tremendous job.
So that was, I think, the most challenging case till date I have encountered. Means it was like we were always looking at I could see the artery from outside. The artery was pulsating inside.
Oh my God. Okay, now on this same topic, is there anything like you want to share, like tips and tricks for the patient, like you have to avoid these things for having, like if you do these things, like you will be getting this thing. If you don't do these things, like you'll be having problem in your hip. Is there anything like you want to give like tips and tricks?
Post hip replacement?
Post and before also. Like for normal people also, for like after operated people also.
Before hip replacement, the general advice is, for example, आपके साथ 25 साल का कोई बच्चा आता है with a bad hip, तो उसको general advice क्या मिलता है? जितना लंबा इसको चला सकते हो चलाओ. I totally disagree with that. होता क्या है, वो 35 के आसपास मेरे पास आते हैं 10 years later, क्योंकि उनको बताया गया था कि जो आपका हिप है वो सिर्फ 10 साल लास्ट करेगा, उसके बाद यू हैव टू गो फॉर रिविजन. अगेन ए रॉन्ग इन्फॉर्मेशन. फिर अगली इन्फॉर्मेशन दी जाती है कि जब रिविजन करेंगे वो तो 2 साल में ही खराब हो जाएगा. So people are so scared of getting the surgery. This is a wrong information. These days we are doing non-cemented and ceramic implants. They last much longer. और MIS technique again यहाँ पे useful है because we are not damaging the tissue.
True.
Anyone who will be doing a revision, he'll get intact tissues. So revision will become far easier.
There is a saying like after the hip replacement to last for 10 years, 20 years, like something. What about like in minimal invasive surgeries, like how long it lasts?
One, we are using the best implants, non-cemented and ceramic. Two, किसी भी rotating structure में, whether it's a wheel of the car or a hip or a knee, अगर आपकी balancing अच्छी होगी, हम गाड़ी की balancing कराते हैं ना wheel. True. Similarly, अगर टिश्यू की बैलेंसिंग अच्छी रहेगी तो वेयर एंड टीयर बहुत कम होगा, जस्ट लाइक ए व्हील ऑफ द कार. तो अगर हम MIS टेक्निक से करते हैं तो हमारे टिश्यूज तो सारे इंटैक्ट, जस्ट लाइक नॉर्मल, तो उसकी वेयर एंड टीयर बहुत कम होती है. एंड बिकॉज वी आर यूजिंग सेरेमिक एंड नॉन सीमेंटेड, तो इट विल लास्ट मच लॉन्गर, एज लॉन्ग कि अगर कोई यंग बच्चा भी कराता है, 25 साल का बच्चा भी अगर हिप रिप्लेसमेंट करा रहा है, आई डोंट थिंक कि उसको लाइफ में 2 बार से ज़्यादा हिप रिप्लेसमेंट कराना पड़ेगा.
Okay. It's not like one time go. Like as you said कि wear and tear हो जाएगा, लेकिन
It will take a long time.
long time. Okay. It is better than the conventional techniques.
Definitely.
Because like the tissue which they have touched over there, the cells, muscles which they have caught over there, and in minimal invasive, it's a very minimal access.
Yes.
Okay.
Yes.
Now let's move to knee. Okay. Knee is a very common thing. Like usually people go with knee pain. Like, is it like knee replacement you'll see in old age only, or like like we see arthroscopic surgeries for like ligaments, ACL and meniscus things. Like, what do you have to say on that apart from TKR?
Young patients में क्या होता है, generally early 30s, people get pain while climbing stairs. That's a very common finding. आपके पास पेशेंट आएगा, वो कहेंगे जी मेरे को ना सीढ़ी चढ़ने में पेन होता है, वैसे नॉर्मल चलने में कोई प्रॉब्लम है. बड़ी कॉमन फाइंडिंग, आपने बहुत सारे पेशेंट ऐसे देखे होंगे. होता क्या है कि हमारा विटामिन डी और कैल्शियम, वी आर नॉट वेरी केयरफुल अबाउट इट. दैट इज़ 1. 2, 30 के बाद जैसी फैमिली स्टार्ट करते हैं, करियर स्टार्ट करते हैं, वी फॉरगेट अबाउट आवर बॉडी, वी डोंट टेक केयर ऑफ आवर हेल्थ. उस टाइम पे हमें अपना कैल्शियम, विटामिन डी एंड रेगुलर एक्सरसाइजेस एंड मोर इम्पोर्टेंटली सनलाइट एक्सपोजर, इन सब चीज़ों पे ध्यान देना चाहिए, सो दैट आवर नीज लास्ट लॉन्गर एंड वी डोंट गो फॉर ए नी रिप्लेसमेंट. कई बार हम छोटा सा इंजरी होता है, मेनिस्कल टीयर हो गया, उनको आर्थ्रोस्कोपिक सर्जरी आप एडवाइस कीजिए या MRI भी एडवाइस कीजिए, दे अवॉइड इट बिकॉज MRI में पैसा लगता है एंड आर्थ्रोस्कोपिक सर्जरी इज सर्जरी. तो मेनिस्कल टीयर को अगर हम छोड़ देंगे, ऐसे कुछ भी नहीं करेंगे, तो इट विल कीप ऑन इरोडिंग द कार्टिलेज एंड अल्टीमेटली दीज पेशेंट्स विल एंड अप इन नी रिप्लेसमेंट बिफोर 50. तो ये छोटी छोटी चीज़ें हमें ध्यान रखना है.
Okay. Means if we don't look after our soft tissues like ligament, meniscus and other things, means there are chances we'll get definitely degenerations.
Early degeneration.
Early degeneration हो जाएगा. Means like, is there any particular things in minimal invasive surgeries for those particular soft
Yes.
tissues?
Yes. We are doing meniscal repairs, and if you have a osteochondral defect, your articular cartilage is defective, there's a crater there, we take graft from one part of the knee and put it there, we impact it there and allow it to heal for 6 weeks. Patient की अपनी ही bone है, वहीं पे heal कर जाती है, and that degeneration doesn't progress further. तो इससे हम knee replacement को further delay कर सकते हैं.
Okay. Is it in use, right?
Yes.
Okay. Now, what about TKR, like in minimal invasive surgeries, like TKR, like total knee replacement? Is it like we have to go with age, or like we have to wait for age?
We have to go with symptoms.
We have to go with symptoms.
Whenever there is pain and we feel that knee replacement is the best option, go for it.
Okay. Now, like, we can manage pain from different approaches as well.
Yes.
Like, if we can manage the pain, means like we don't need to go for surgery.
Yes, pain is the only indicator is pain.
Pain, true.
If we can take care of pain without painkillers, we can wait.
To be precise, like I have seen many cases like joint spaces are also less, but they don't complain any pain. Whenever they go to any like medical individuals, and they are saying like better to go with surgery, means like pain and other things are the only indications, right?
Only indicator.
Okay. Now, can you explain a bit more about like the procedures of TKR in minimal invasive surgery?
This minimal invasive we started with hip, but now we have applied it to knee also. In conventional technique of knee replacement, we cut the quadriceps muscle, open it up, operate, and then stitch it back. But quadriceps हमारी main muscle है. Patient को जब first day walk करना है या second day जब सीढ़ियाँ चढ़ना है, तो quadriceps is the only muscle that is going to help. और उसी को हमने damage कर दिया.
True.
One, there will be bleeding during surgery. Two, patient will have severe pain, and muscle power will come one grade down.
True.
From 5 to 4.
Yeah.
तो पेशेंट का इतना कुछ हमने सेटबैक कर दिया है, वो अपनी सबसे स्ट्रॉन्ग मसल को डैमेज करके. तो हम क्या करते हैं, वी यूज MIS टेक्निक. हम इस मसल को वन एज से लिफ्ट करके लैटरली स्लाइड कर देते हैं, पैटेला को स्लाइड कर देते हैं. वी पुट ए न्यू नी एंड अलाउ द मसल टू कम बैक.
Okay.
Not a single fiber of quadriceps is touched. No bleeding, no post-op pain, और patient की performance number 1 from 24 hours onwards.
Okay. Then, like, if you have done this kind of surgeries, like, means like from our aspect, like from physiotherapy aspect, like if we see from the conventional technique, means we need to struggle a lot. Because like after surgery, after the surgery is done, the thing is like we have to do a lots of physiotherapy on that. At least 3 to 4 months, sometimes 6 months also. But like I have seen few minimal invasive TKR, but surprisingly within 2 to 3 weeks, what we are wanting on that particular knee, like, oh my goodness, I'm so happy. And I'm said, do we need to do something more? And they are perfectly fine. That's the advantage of that MIS, because I have seen many cases.
No, it is hardware and software.
True.
So generally we think that we have replaced the hardware, software will take care of itself. No, it is software that we have to be very careful about. Hardware तो अच्छा है, वो तो अच्छा बनाया, सिरेमिक का बनाया है, गुड शेप, गुड ज्योमेट्री, एवरी इंजीनियरिंग बड़ा अच्छा है उसमें. पर सर्जन की इंजीनियरिंग तो सॉफ्टवेयर में, सॉफ्ट टिश्यू में है. अगर मैं अच्छी सर्जरी नहीं कर रहा हूँ, दैट मीन्स आई एम डैमेजिंग द सॉफ्ट टिश्यूज. So my contribution is nil if I am damaging the soft tissues.
Okay, like let's conclude all these 3 things in perspective of MIS, minimal invasive surgeries. Like scar is less,
Yes.
incision is very less, recovery speed, like recovery days are very less. They can get back to their work within like 50 to
weeks, days.
weekdays. And these are the things. Like, is there any limitations of minimal invasive surgery?
Only limitation is that expertise is difficult to find. So you have to travel a lot to find a good MIS surgeon. That is the only limitation.
Okay.
It's not costly, I'm telling you. People generally think that there's a new technique, it must be costly. But actually it's cheaper because the number of days in hospital is less.
Stay is less.
You are taking less medicines, you are taking less antibiotics. It's cheaper that way. So that is the only limitation, that there are very few people who are actually practicing genuine MIS techniques.
Now let's move to our very most popular segment, Mythbusters. Okay. In every field, there are some misconceptions. Is there any misconceptions in your field, like minimal access orthopedic surgery? Like, is there any misconception so that we can bust that myth?
One very weird misconception that many people tell me is that if you go for an artificial joint, is many people, काफ़ी जो रूरल बैकग्राउंड से लोग आते हैं, वो ऐसे क्वेश्चन, पर ऐसी चीज़ें मुझे बताते हैं कि हम सरप्राइज दैट ऐसी चीज़ें एग्जिस्ट करती. वन इज़ कि अगर आप कोई यंग एज में एनी सर्जरी अराउंड योर पेल्विस, जैसे हिप रिप्लेसमेंट है या स्पाइन सर्जरी कुछ भी करते हैं, तो यू हैव डिफ़िकल्टी in becoming a father or mother.
The same thing is one patient came today, a lady.
That's very strange.
She asked me the same question. Is there any problem in fertility?
Not at all.
Right.
And with MIS technique, the girls are going for normal deliveries. No cesarean, nothing.
Okay. Now, is there any misconception like the old traditional concept, like that conventional technique and MIS techniques are same techniques? Is there any myth like something like that?
Yes, many people tell that MIS is just a small incision. I'm again trying to explain that it is not a cosmetic surgery. It is not just the size of the incision. It is the internal damage that will limit in MIS technique.
Okay. Now there is one more other segment, that's action segment. We'll be asking a few questions to the doctors from our viewers. Like they'll be asking the questions and he'll be you have to answer some of the questions. Okay. Now, what are the questions?
Would you recommend MIS to the elderly? If they do opt in, what is your advice?
Yes, actually MIS elderly के लिए बहुत अच्छी technique है. Many of these patients have heart problem, kidney problem, or they have diabetic issues. और ये पेशेंट डर जाते हैं कई बार सर्जरी से कि मुझे तो इतनी सारी प्रॉब्लम है, हाउ कैन आई गो फॉर सर्जरी. MIS में बिकॉज वी आर मिनिमाइजिंग द डैमेज, वी आर पुटिंग लेस स्ट्रेस ऑन द बॉडी, वी आर मिनिमाइजिंग द ब्लीडिंग. तो इन पेशेंट्स का जो पेन किलर इनटेक है, जो स्ट्रेस ऑन द बॉडी है, द चांसेस ऑफ गोइंग टू ICU बिकॉज ऑफ ब्लीडिंग, दे आर ऑल मिनिमाइज्ड. सो MIS इज़ वेरी सूटेबल फॉर दिस पेशेंट्स. अब तक जो बहुत सारे पेशेंट हमारे इनऑपरेबल थे, जिनको हम मना कर देते थे, MIS में अब उनको हम कर रहे हैं. फॉर एग्जाम्पल, रिसेंटली वी हैड ए पर्सन who fell from the roof. He was 65 and he had a fracture of L1. We fixed it by MIS technique, and next day the patient was walking, and it was done under local anesthesia. It is called balloon kyphoplasty.
Okay.
That fragment was fixed with the balloon kyphoplasty. It was done under local anesthesia. Otherwise, that patient was not suitable for general anesthesia.
After undergoing surgery, can I go back into playing sports? What is your advice for a speedy recovery?
Yes, that is a very common question. जो यंग बच्चे हमारे पास आते हैं फॉर हिप रिप्लेसमेंट स्पेशली, होता क्या है कि इस सर्जरी के रिजल्ट MIS से इतने अच्छे हो गए हैं कि आफ्टर फ्यू मंथ्स these patients forget that they ever had a disease. That's a compliment for us. But the worst part is that they become overconfident, and they want to play cricket, football, which is very popular in our country. My advice is, you can go for swimming, you can go for light jogging, you can do gym exercises, some gym exercises, not all of them. You can dance, you can, these are the basic things you can do. Even you can go for yoga. Many asanas of yoga you can do. But contact sports, where there are chances of collision of players, football and cricket, where there are chances of falling down, sudden change of direction, ये आपको avoid करना चाहिए, so that your implant lasts longer. We don't want to operate you again and again.
After undergoing surgery, can a manual laborer go back to work?
इन जो पेशेंट हमारे मैनुअल लेबर होते हैं उनको हैवी वेट उठाना पड़ता है, एंड दे समटाइम्स हैव स्लिप डिस्क, जिसको हम शैटिका कहते हैं. अब 35-40 पे कोई पेशेंट मेरे पास आता है कि उसको स्लिप डिस्क हो गया है, दे हैव टू गो फॉर स्पाइन सर्जरी, दे कैन नॉट चेंज देयर जॉब बिकॉज देयर स्किल्स, देयर रेंज ऑफ वर्क इज़ वेरी लिमिटेड, द फैमिली इज़ डिपेंडेंट ऑन दैम. तो इस एज ग्रुप में दे कैन नॉट चेंज देयर जॉब. इसमें एंडोस्कोपिक टेक्निक इज़ वेरी यूजफुल बिकॉज वी आर नॉट रिड्यूसिंग द मैकेनिकल स्ट्रेंथ ऑफ द स्पाइन. आफ्टर 6 weeks वो सब काम कर सकते हैं, वेट उठा सकते हैं, झुक के काम कर सकते हैं, उनको हाइट पे काम करना है, सीढ़ी पर चढ़ना है, पुश करना है, पुल करना है, वो सारे काम कर सकते हैं.
So very wonderful answers and very tricky questions as well. Like now let's conclude this conversations. I'm very glad to have you in my show. It's my immense pleasure to welcome you in my show. Do you have anything to say for the general audience, like for any people who will be listening to our podcast?
I'm honored to be on your channel, and I wish you all the best for future. And I take this opportunity to give a general message to people who are suffering from orthopedic problems, that it's your right to demand the best possible technique, the best possible implant. For that, you must be aware of it. And people like Dr. Amir and me and many other people like us who are spreading this information on social media, It is just for the same purpose that you should know what is best for you. It is your right. So similarly, MIS technique is there whether you are suffering from a knee problem, आपको हिप की प्रॉब्लम है, स्पाइन की प्रॉब्लम है, घुटने की प्रॉब्लम है, आपको ये चीज़ डिमांड करनी है कि हमें सिर्फ MIS टेक्निक से करना है, बिकॉज दिस इज़ बेस्ट फॉर योर बॉडी, आपके फ्यूचर के लिए, आपके फंक्शन के लिए, परफॉर्मेंस के लिए, आपकी फैमिली के लिए. दिस इज़ द बेस्ट टेक्निक अवेलेबल राइट नाउ. तो आपको ये चीज़ मांगनी है. जब मांगेंगे कोई चीज़ तो मिलेगी, और जब आप मांगेंगे तो हम और भी ज़्यादा हार्ड वर्क करेंगे कि आपको उससे भी अच्छा रिजल्ट दे पाएँ.
Thank you very much. Please like, share, and subscribe our channel. If you have any queries, you can ask in our comment section down below. Thank you very much. Thank you very much.
Thank you.